It all began with the vision of Sir John Wilson, who founded Sightsavers in 1950 as the British Empire Society for the Blind. Despite being blind at the age of 12, he spent his lifetime working towards curing and preventing avoidable blindness around the world. Sightsavers started operations in India in 1966 by supporting eye care camps to treat xerophthalmia or dry eyes, treat cataract blindness through surgeries, and sensitize the public on the dangers of vitamin A deficiency. The organization established a strong outreach program in 1966, providing mobile eye care vans and equipment support to a hospital based in Vellore in Tamil Nadu and Sitapur Eye Hospital in Uttar Pradesh. Dr. Rajendra Vyas, an eminent activist working for the blind, joined this mission and became its first Asia director. He provided leadership to the India program and was conferred with Padma Shri in 1982 for social work. The organization got registered in 1970 under the Bombay Trust Act as Royal Commonwealth Society for the Blind. In 1974, it became the first organization to respond to the Government of India's scheme of integrated education for disabled children. Sir John Wilson, Dr. Mehre and Dr. Venkataswamy joined hands to advocate the cause of blindness and met the then Honorable Prime Minister, Mrs. Indira Gandhi. The efforts were successful when in 1976 the cause of blindness became part of the 20-point agenda and India became the first country to launch the National Program for Control of Blindness. When Royal Commonwealth Society for the Blind launched the Eyes of India campaign, the eyes of over 1 million people were examined and treated. The society supported the setting up of first permanent base hospitals in India to provide low-cost mass treatment. The community-based rehabilitation program took shape in 1982. In 1983, the organization launched its first national program on blindness. The xerophthalmia program, which targeted blindness due to anemia and nutritional deficiency, ran across 17 projects within the country. The organization piloted the integrated education program in Visnagar, Gujarat, to mainstream visually impaired rural children to schools. Sightsavers were the first eye care organization to respond to the 1984 Bhopal gas tragedy by sending ophthalmologists, relief supplies, medicines and equipments. New eye care products evolved during this era. Sightsavers supported Arvind Eye Care System to manufacture intraocular lens and sutures through Oro Lab, making high-quality cataract surgery affordable for all. The organization supported L.V. Prasad Eye Institute in the development of cornea preservation medium, enhancing the shelf life of cornea for implants, revolutionizing eye banking. The organization supported academic programs and fellowship for eye health professionals in microsurgeries, retinoplasty, cornea transplantation and hospital management in partnership with Arvind Eye Care System, LV Prasad Eye Institute and Seva Rural to ensure enough professionals in the sector for service. It supported setting up of various eye care centers in 1990s. The organization advocated the shift from surgical camps to preventive diagnostic camps and initiated the comprehensive eye care services including low vision, rehabilitation and glaucoma within existing services. Sightsavers in India became one of the founding members of Vision 2020 India with the Right to Sight, an autonomous body to advocate right to sight and renew its vision to prevent blindness. The organization with Vision 2020 shared its learnings through publications of manuals and guidelines to be used by students and professionals benchmarking best practices. These knowledge resources found endorsement from the Government of India. The organization scaled up its work to 14 states, ensuring services across the remotest part of the country. With decentralized offices across the country and partners operating in the scaled-up geography, Sightsavers programs are closer to the communities. Sightsavers pioneered the Integrated Education (IEDC), which got subsumed in 2009 with Sarva Shiksha Abhiyan as inclusive education. The organization supported formation of Disabled People Organization and Blind People's Organization for sustainable and lasting change. During this period, the organization calibrated its program strategy focusing on system strengthening and driving sustainability in states that have poor health indicators, thereby covering 100 districts and 8 states. Sightsavers developed strategic partnerships with state governments and other strategic partners in the field of eye health, social inclusion, and inclusive education. The organization brings evidence and grassroots learnings at global level, influencing shift in focus at policy level. Sightsavers in partnership with XRCVC successfully advocated with the Reserve Bank of India and the Indian Banks Association for accessible banking and financial services, resulting in the first installation of accessible ATM for the blind with voice enablement and braille labels in 2012. Presently, there are more than 7,000 ATMs across India. This initiative got nominated for the Times of India Social Impact Awards in 2015. Sightsavers worked tirelessly along with other partners and successfully brought about the amendment to Indian Copyright Act 1957, which was passed by Indian Parliament in 2012. This resulted later in the Global Treaty for the Blind in 2013, Marrakesh Treaty. India ratified the same as the first nation in the world in 2014. Sightsavers would like to express its gratitude to all its partners, donors, supporters, and the government, with the help of whom the organization has been successful in completing this 50-year journey.